medical laboratory science, and he has authored and co-authored around 40 scientific papers published and presented in national and international journals. So please join me in calling Professor Dr. Mohammed Nazim Zilla to present on the topic of medical diagnostics, present, past and future.
All right, good afternoon, everyone. Okay. Thank you to our moderator for generous introduction about me. Thank you to our moderator for generous introduction about me. And first and foremost, I would like to take this opportunity to say huge thank you to Bell University for the first International Joint Conference on Medical Health Sciences. I hope this conference will be extended for a couple of years in conjunction of our collaboration. Okay, then, all right. I start my presentation today with this kind of very important recommendation on IR 4.0. All right. So you can see from this video, actually it's a very important the era on the regularization, whereby we started on the first regularization, which is we using mechanical and also steam and also water power. And then we move forward on the second regularization of the mass production and also electricity. And then on the third is a very important on the electric IT system and also automation. And finally, we are in the era cyber physical system. And now we are towards AI in the 5.0 implementation. Okay, next slide. Alright, I think this is a very to know regarding the personalized medicine, whereby the country and also the world has been contributed more than billions to ensure on the safety and also medical treatment to everyone. So you can see from here, for example, like national health system in the United Kingdom has been invest more than 12 billion to ensure that it's very also accelerate in terms of the patient care. Next slide. So from that, I believe everyone in this hall medicine, whereby it's very important to look on the individual techniques of personal characterization and also in terms of the treatment between one to another. Next slide. So from that, the era has been looked into from the beginning. You can see from early 2003, whereby they completed on the Human Genome Project. And then towards that, they are looked on the building, on the knowledge network, on the biomedical research toward the new taxonomy of disease. And then 2014, you can see the implementation is a very important on the personalized medicine. And from that, in 2015, they are already embarked on the precision public health, whereby started in United States, and I believe from 2017 onwards is a very important. They look on the delivery of the healthcare system in this era. Okay, next slide. So I believe this is a very classical diagrams. You can see it's a very important the years how drug has been delivered. You can see from beginning how people look on the decision of the development, and then from that they have to come up with the cell assay development, and then look on the test and also identify the compounds. I believe all the students in this hall, majority from the pharmacy program, I believe we know how to know extraction using the HPLC to identify the drugs. So from that you can see it's very important from the animal models, and then towards on the clinical trial phase 1 up to phase 4. Alright, next slide. So from there, I think this is very important that we look previously how people using the drugs for one drug to all people. Okay, so from that you can see it's very important to look on the effects, no effects, and also the adverse effect as well. So because sometimes people don't realize the importance of the output on efficacy of the drug. Next. So from there, so you can see from here how the people look on the traditional medicine. Okay, so they move forward on the satisfied medicine, and finally they look on the precision medicine, whereby it's very important that we look on the from beginning from the genomics up to the endogenous factor as well. That's why it's very important to counter every single diseases to identify and measure the output of the disease. All right. From there, you can see the efficacy. Next slide. You can see the efficacy of the drugs. So you can see from one drug, we have treat individually to individual person and also diseases. So we look on the genomics and also personalized, and we can see the output of the drugs. From one person to another person. So we can see from the positive effects on the drugs, and also on the on the analysis as well. All right. Next. Okay. After that we have we know about the COVID-19, and then from that. From this era, I think it's a blessing of this virus as well, because all the processes will be accelerated in terms of the technology and also the identification of the drugs. Okay, next. So from there, you can see it's a future. We have to shorten from 18 years to 9 years. Okay, you can see a lot of the combination between the integration for big data analysis on the bioinformatics, and then they look on the animals models, and finally they can shorten in terms of the clinical trial as well. Alright, so this slide I think is a very common. Later on Dr. Basu will be explained in detail. So this is in terms of the genomics. Is a very important. We look on the genomics, and then we have to in terms of differences between genomics and also genetics. This kind of terminology. Alright, next slide. So from that, you can see from the that is very important. We look on the single cells, and then the people has been explored from the whole genome, and then they look on the clinical exome. Finally, they look on the single gene as well. This is very important that they have to analyze between one gene to another gene to identify the disease. Alright? So next slide. Alright, from here you can see from the history on the Human Genome Project. So this is the era that the big data analysis has been looked into it, because they have every single gene and then they look on the function as well. So from that they know what kind of the diseases and what is the best treatment for certain diseases. Alright, next slide. So from here, you can see like is what we call is like similar like Google Map, that they look on the very important on the combination, on the detection is from genome up to metabolomics, and then from all the information here they look on the information, and they look on the integration. So from here they can see either the important on the networking and also the communication and also the trajectory of the genes. Okay, this is a very important beginning, the way how they identify the diseases and also the gene communication. Alright, next slide. As I mentioned before, it's like a Google Maps. They look on the areas, and then finally they look on the structure, whereby it's very important to gather all the information from the individual patient up to the axon and also the signal of the symptom as well. Alright? From here, so you can see the integration between they look on the diagnosis, which is very important on the accurate, and then the treatment on the targeted, and finally it's a very important help to look on the health outcome as well. So from here, they look on the first step on the laboratory science, whereby the integration between a molecular mechanism up to the enzyme identification, and from that they have to integrate every single factors from the genomic, epigenomics, and also proteomics integration, and all the information network they have to put in big data analysis, and then from that they can get the information on the data population health as well, and very important to synergy all the information to identify the disease. Alright, next slide. As I mentioned, in 2015, whereby the Barack Obama has been addressed very important on the precision medicine. From that, the United States now is do a treatment every single patient with a different treatment to the nation. Alright, next slide. You can see, okay, before this we look on the symptom aspect. So now we look on the pattern base, and finally I believe they're using data, big analysis, and also algorithm base to identify the treatment and also the medicine as well. That's why it's a very important the integration on the big data analysis. Alright? So we can see in real situation, next slide, whereby they look on maximum is about 2 weeks from the patient see the doctors, and then they look on the biopsy, and then they look on the pathology, review, sample, preparation, and finally on day 14 to 15, the result and also the treatment. So this will be accelerate the process on the patient treatment. Okay, next slide. So you can see, for example, like a patient sample from the rare disease and also from the cancerous patient as well. So you can see what the pattern later on. Okay, next slide. So from here, they can look on the very important on the 4 area. They look on, for example, on the tumor diversity and also electricity, and then from that they look on the tracking evaluation of the individual cancers, and finally they have to do on the characterization and also the microenvironment, and finally they look on the new mechanism of the drug resistance as well. So they will be integrated in one during the the therapeutics opportunity. Alright, next slide. So from there, all the information will be, you can do a screening, and then you can see from abroad of the dividends, whereby the gene communication in the body from the male, female, and also pediatric patient as well. So from that they can see the pattern recognition on the gene as well. So very important, next slide. They cooperate with the computer algorithm, whereby we are moving forward on the AI. So you can see they already started earlier, whereby they look on the detection, on the life threatening on the disease as well. Okay, next slide. So from that, they are integrated using the engineering precision medicine technology, whereby they are cooperated between the genomes, and then you can see on the diagnostic, and then they look on the therapeutic, finally on the device. So this is what the integration of the technology. Okay, next slide. I think it's very important. You can see from here whereby the clinician look on the diagnostic, and then to identify on the prognosis, and then the clinical trials, and finally they look on the therapy selection and also the cancer susceptibility as well. So this will be integrated system to identify the disease. Okay, next slide. Okay, I believe this is a very, I think you know this actress, right? Okay, this actress, Angela Jolie, she got breast, the family, the mothers and also the sister died because of the breast cancer. So what she did, she do the microarray analysis to identify either the gene turn on or turn off as well. So what we did, they using the recent technology microarray to look on the gene profile, because she believed the breast cancer will be genetically transferred from the mothers to her. So she removed the breast cancer. So she removed the breast cancer using the mastectomy to ensure there is no gene, the breast cancer gene will be appear later on. Okay, next slide. So from that, this is another important that they are using a very smart, device. So I believe when we talking about the DNA sequencer, it's a very huge equipment. Now it's a very small device you can carry out from one to another to accelerate in terms of the identify of the DNA sequence. All right, next slide. Okay, similar technologies. So you can go from one area to another area using this device to ensure that people can using and then to get the data analysis as fast as we can, because this is a very important big data analysis. All right. From there, next slide. So from there, I believe next slide. Okay. From this, era, I believe everyone have a smart, phone, whereby all sort of the, application in terms of the device has been installed in the system. So, for example, like during a COVID-19, everyone have their own device to update their status similar to Malaysia, like everyone compulsory to install like my signature. But I'm not sure in India they're using what kind of apps people can, updates regarding what the government can trace the location whereby the pandemic occurred during that time. So from that, you can see, I believe because of the COVID-19 virus, the technology has been accelerated in terms of using IT technology. So from that, you can see now these people using like watch to look on the many things like ECG. You can look on the cardiovascular detection, and I believe there is others technology can implemented. They're using from the GPS, and then from that they can have like so many devices available in the market, whereby people can check and also to look is the health status time to time. All right. So this is the function on the engineering side, how the mechanism and also the function of the device will be triggered to everyone or alert in terms of diagnostic and also the therapeutic as well. Alright, similar to this diagram, so you can see from here, it's like everything is integrated. Okay, you can see from beginning, and then they also look on the omics analysis, and then big data analysis, laboratory, and finally they look on the public health as well. It's very important on the personalized medicine as well. So next slide. Besides that, I think this is a very important towards on the human welfare, because from the precision medicine, so we can look on the personal medicine, and then they have to look on the healthcare as well, finally to benefit to the community as well. Alright? Next slide. And all this will be integrated. Okay, I believe everything is integrated and is a benefit to everyone at this moment. And so you can see it's a very powerful ecosystem between one department to another department. Alright, this is the same thing. The benefit to the system, the community. And finally, you can see the next slide. You can see now people look on the integration every single aspect. Okay, either on the healthcare system, either ambulance, for example. So you can see so many things is integrated, and I believe there is like a smart city integrated every single system in the ecosystem in the community and also in the world. Okay. Before I end my presentation, I leave you with this next slide video, whereby we can see it's a very important on the situation in medical technology.
Devices. The information gleaned from smartwatches and sensor-based socks, pacemakers and replacement knees, oxygen sensing patches and smart mirrors could, and in some cases is already starting to help patients improve well-being, anticipate issues, and change behaviors to maintain overall health. That move from device maker to data provider entails a radical shift in business models. Instead of making incremental improvements to devices, medtech companies will use transformative, cognitive technologies to reshape how we approach health. Dealing with the wash of data is daunting, but medtech companies don't have to do it alone. Instead of viewing technology firms and specialized digital health companies as competitors or disruptors, what if medtech saw them as partners? These consumer-focused companies already collect, store, and analyze vast amounts of consumer data. What they lack is deep industry knowledge and credibility with care providers. And that's exactly what medtech companies bring to the table. Joint working teams between consumer tech and medtech have the potential to reduce medical costs, optimize provider performance, shift the care setting, improve patient outcomes, putting them at the epicenter of the system, and help society transition from an acute care model to one that fosters prevention and early detection. All of which bring medtech companies closer to consumers and keep them critical as we transition into the future of health.
Okay, with that, I end my presentation. Thank you.
Thank you, sir, for enlightening us with the knowledge. Now, I request Dr. S. Jayakumari, Ma'am, Professor, Department of Pharmacognosy, School of Pharmaceutical Science, Vistas, to felicitate Dr. Nasir.
Next up, I would like to intro our third speaker, Associate Professor Dr. Vasudevan Ramachandran, who will be discuss about the role of pharmacogenetics in the modern scientific world. Associate Professor Dr. Vasudevan Ramachandran obtained PhD in Genetics, University Putra, Malaysia in 2009. Currently works as an associate professor and as director for postgraduate and internationalization at University College of UCMI International, Kuala Lumpur, Malaysia. He has worked as a postdoctoral researcher and senior research fellow in University Putra, Malaysia for more than 8 years. He has received more than 20 million of research grants as a principal investigator and co-principal investigator. His research outcome has been published nearly to 99 papers in international peer-reviewed journals and has presented more than 60 papers in conference. This article has been cited more than 2,400 times, which earned H index for 23. Its primary research interests in the field of genetic association studies, quantitative research, systematic reviews, and meta-analysis, and conducted several workshops and seminars on research methodology and publication. He is serving as a reviewer and academic editor for many impact factors journal. Now I call upon Associate Professor Dr. Vasudevan Ramachandran sir to start his section. Please sir, the stage is yours.
Hello, good afternoon everyone. First of all, I would like to thank you, Dr. Shanmugha, for organizing this conference as well. And of course, we are the co-host, and we are all from the College of Mybek International, which is in Kuala Lumpur, near to Mother Caves. I think you all know about that one. The statue of Murugan one, which is near to the one our university is there. And as Prof said that, we will be talking about a lot about the precision medicine. So the main thing is my talk will be on the role of the pharmacogenetics in the modern scientific world. So how we are going to see this development, I know, but it has been developed a lot. Developed is almost more than 30 years back. It has been already developed, but still we can say that pharmacogenetics in its infancy stage, because it has to be established a lot, even though they have discovered a lot of things on basis of the pharmacogenetics. Next one. Okay, I think all of you know about the pharmacogenetics. It's just simple kind of things that how the gene is response to the drug. That's all. So you have to know that each and every person will be responding to the particular drug. So we have to analyze the genetic profile that how is going to respond based on your drug, and it's easy for you all to reduce the cost, and also of course you can prevent it and you can have the better way of the treatment. So some of the goals you can see there, next slide. Some of the goals of the pharmacogenetics you can see there is basically for the individualized treatment. So that's what we say is a personalized medicine, where everyone also can have their own genetic profile, and then you can, doctors will be, physicians will be suggesting that this is a particular drug. So that's why you need to have the personalized medicine. So I can suggest that nowadays the sequence is quite, it's not an expensive one. Earlier it was very expensive. Now everyone can have their own DNA sequencing. That's the genetic profile. So the physician can ask you to do the genetic profiling, and then each one can have the genetic profiling, and you can take the data to the physician or a pharmacogeneticist one, and they will be suggesting the right drug for you. That's the main thing. So instead of that, for example, if we have fever or we have headache, you just try to get one tablet. Usually we take the paracetamol or the paracetamol one here, right? So that sometimes it won't work, so you have to take another tablet. Then again you will have more headache for another 2 days. So you keep changing the drug. But if you know your genetic profile, you will be taking the right drug. Then you don't need to have the your treatment will be much better. You will get cured in a few days because you have a genetic profile and you are taking the right drug. So that's the important thing. That's the most important thing, the basic idea of the pharmacogenetic one. But pharmacogenetics usually is based on the single gene. Then apart from that, of course, you can improve the efficacy one and safety improvement and optimize dosage and reduce trial error and advance precision decision. So these are the main things that we have to look up for the pharmacogenetics one. The next one. So why we want to do the pharmacogenetics? Some people will be thinking that nowadays they are doing the pharmacogenomics. It's just nothing but that pharmacogenetics is based on the single gene, where you want to do for the multiple genes, then it will be the pharmacogenetics, and it will be pharmacogenomics as a genome based one. But here only the single gene based one. So that's why we are focusing more on the pharmacogenetics. But nowadays a lot of pharmacogenomics have come up with advanced technologies. But we will see that the basic one, that how it has been developed. So pharmacogenetics usually you see the genetic variations. I hope that everyone knows about the genetic variations, where the single nucleotide polymorphism, you can see the mutation one and the insertion, deletion. So all those kind of things comes under genetic variant, then how it responds to the drug. And then you can see that of course it will be helpful for the healthcare providers. The next one. So for example, you can see that what are the drugs it has been there and how which genes is the response to the particular drug. For you can see that the clopidogrel is one of the very good one, is helpful for the blood thinners. So many of them they have a blood clot one, so they will take this kind of drug. But they need to see the genetic profile that how the patients respond to the particular drug. So based on that, they will give you the dosage, because you need to activate this drug one. That then only you will get curing. So otherwise it's quite difficult. So you have to know the genetic profile and the particular gene, the CYP2 C1 gene. So that's the most important thing, and then they will be looking at whether it's activating for the activation or not. So that's the important one. Apart from that, omeprazole is there, and also tamoxifen is particularly for the medications they are using for that, and abacavir is for HIV treatment. So these are some of the drugs they are using, and they are checking the genetic profile. So, many genes diagnosis of any diseases, but they are doing a few on that, and only for that only the homogenetics will be available. It's not that for each and every disease, but mostly is used for the cancer oncology one, secondary one, and also for the cardiovascular diseases. Next one. Usually they will do the biochemical test. They will be taking the blood samples or any samples, any source of samples. They try to extract the DNA and they will see all the genetic profile, and also they will see the biochemical parameters. And then that's the traditional one. But whereas here in the homogenetics, they will check the biochemical samples as well as they will try to extract the DNA, and they will try to see that which particular gene is responding to the particular drug. And based on that, they will be giving the dosage and also dosage to the patients, whether it's the higher dose or normal dose or alternate one. So this is basically following the clinical one. So how, as I said, that the patient will be visiting the physician, and then the homogenetics consultant will be checking that what type of genes you need to look it out based on the what kind of disease you have, and they will be looking all the genetic profile. And with that data, they will be suggesting the right drug. But before that, they will do some kind of intervention that how much dose you are going to take it out. Because this one is reduces the cost as well as the time, and it is better for the patient's improvement. Yeah, next one. And we see that biomarker discovery. Next one. Biomarker discovery, analytical validation for the genetic variants and clinical validation, and later on they will be applying for the clinical implementation. So this is the basic steps they will be doing for the homogenetic one. So let's see the next one. Let's see what are the causes for the individual variability. As I said that we can see one of the things is G1, and of course apart from the genetic side, we also see that what are the drug interactions, drug-drug interactions, and also the risk factors, and then basically the gut microbiota also. This is one of the hot topic right now. They are looking forward that how these kind of things helpful, and they try to prevent the disease using the gut microbiota profiling for individuals. And of course gender side, disease state. So all these things is cause for the individual variability, but basically most of things is based on the gene side, genetic side. The next one. So usually the genetic reference is the missing piece of the puzzle for all these days, and this is now easily accessible through the pharmacogenetic side. So these kind of tests can be used for the reasoning, and then it can be helpful for assisting the healthcare. And of course, now is considered as a crucial one for the genetics one and for prescribing the medication. So that's why we need to focus more on the genetics, even though there are other risk factors or there for variability one for the causes one. The next one. And when I talk about the genetics, the most important thing I say is the single nucleotide polymorphism. We call as a SNP, where a particular nucleotide has been replaced with another nucleotide, and because of that, there will be a mutation. We can say there is a missense mutations or can be sometimes silent mutations. So these are the mutations SNP will be responsible for the development of many diseases. So genetic disability, even for hypertension, diabetes, some of the genes are responsible for the development. Even for the cancer or this. So for this one, we will see that which genetic variant is that and how it has been respond to the drug. So this is the first thing is we need to know about the SNPs. The next one. And based on the SNP profiling, then we will see that how the drug treatment is working for the particular person, whether this person will be work or not, whether its efficacy is or not. So all these things will be analyzing one just based on the genetic profiling and based on the genetic variations, that too only the single nucleotide polymorphisms. The next one. There are so many methods to detect the genetic variants. As you see that, you can see most important thing is they use the PCR movie, which is a traditional one. Even still now, a lot of researchers are publishing based on the RFP technique. Also is a traditional one, but now we can do the validation point. I think those who are working on the genetic polymorphism, they know about this technique, PCR RFP. But apart from that, nowadays with the advanced technologies, they have moved to the genetic profiling by using the DNA microarray and the next generation sequencing. That's the most important thing. It's quite, even though it's quite expensive, but many companies, sequencing companies, they are willing to do the service, and then we just simply give the samples and they will do analyzing part. So that's the thing they will do, and then cost also is not that much expensive as well. Okay, the next, these are some of the methods, and the next one, you can see that particularly I'm just focusing on the next generation sequencing, where the samples will be taken from either from the healthy individuals or from the patients, and later on you will be they will be analyzing using the NGS sequencing machine, and you can see that genotyping, they have to look what are the genetic variations are there. So for that particularly they need to see the what you call the genetic identification and then variant classification. This one will be based on the bioinformatic ones, and because it's all combined with all the fields. Basically the bioinformatics plays a major role in the NGS. And then you can see that that report will be given to the pharmacogenetics, and they will be sending the report to the physician, and based on that the patient will be, the physician will be giving the drugs to the particular patient for the better improvement. But you can ask that whether it's happening now or not. As I said that in India it's quite less, but in other countries, even recently the FDA has approved more than 21 drugs. That is particularly based on the few diseases like lung cancer and all these kind of things. They have approved a few drugs, and they have want to find the particular biomarker. And they are already, the pharmacogenetics is going on in few countries. But in India it's still a long way to go. And I have just checked that some of the research they have done based on the pharmacogenetics and cancer, and you can see that there are so many publications and papers, articles have been published so far based on the pharmacogenetics and cancer, as well as in the psychiatric one. The next one. And the next one. The current approach, you can see that as they say that the drug has been prescribed, and then the prescription filled with a lot of doses, and then you can see that they just looking the genetic test. But this genetic test is just really is an optional one. It's not the compulsory one, but they will be explaining all the benefits if you want to do the genetic profiling. Of course, here is a bit expensive. It will be more than 30 to 50,000 for a single for the individual person, and then they will be asking whether you want to do it or not. So once you agree with all those kind of things, then they will be taking the blood samples and they do the genetic profiling based on any kind of test. But usually they do the NGS. So that's the analysis they will get in, and then you can do the prescription one. And nowadays they are doing this kind of things. As I said that in many countries they are following the future approach, the one for the genetic profiling based on the individuals. The next one. So the current medicine is fixed for everyone, but nowadays, as I said, it will be they will be choosing which person should get how much dose and which drug. So that's the future approach for as of now. But you can see that the more personalized diagnostic will be applicable for all the patients, and also for the physicians will be easy for them to give the right drug. They don't want to give the so many drugs to see the intervention. But this one they already fixed that okay, this is the drug for you, and this is the dose they have to give it. So it's more easy for all the patients to get cured fast. The next one. So here you can see that earlier, as I said, that pharmacogenetics was the one they have done it, started earlier, but now they moved to the pharmacogenomics where multiple genes are involved. It's not that only single gene. For the development of hypertension, there are so many genes out there, particularly angiotensin converting enzyme. So that one is responsible for both hypertension diabetes and many genetic variants involved. So what they have done is they want to know the other genetic variants involved in the other genes. So they have to go for the pharmacogenomic science. So they will be looking forward each and every gene and which are the one they consider for the development of the disease as well as for the responding to the drug. And also they have moved the one playing a role here. So these are the next to the open side. Yeah, medicine. So they have given a lot of research grants, and then also they have tied up with the many industrial want to do more research on the personalized medicine because they don't want to waste the time as well as the cost. So they want to waste it, and they have come up with many kind of collaboration. The recent one, the Infosys, they have launched the SAP-based personalized medicine solution for the pharmaceutical companies. And also there are so many research grants out there. Later on, we will be discussing with the lecturers, and we will see that what type of research grants are available, and we will come up with some kind of. We will be submitting a proposal, and hopefully, we will make it the research grant as well to do the further research. And many other things are going on. As you see, the Mayo Clinic also, they have collaborations, and they want to do the more research on the personalized medicine. The next one. And they have combined together the personalized medicine to do the research, and you can see that they are taking all the data sources and data collections, and with that they do the data modeling and processing, and based on that they do the data integration to the precision medicine. So this is the current latest technology. This is the one Profan was talking about, that India can do a lot of data we have. So we are developing the AI one for the using the big data analysis, and particularly for the precision medicine. So this is a future one, and of course some of the researchers they already started doing this one. The next one. And here you can see that pharmacogenetics technology market, you can see that by technology, most of them are using the PCR as the main one for diagnosing for identifying the genetic variant, apart from the sequencing as I said, but mostly they are using on the oncology part, particularly for the lung cancer, breast cancer, colorectal cancer, and apart from the neurological disorders, cardiovascular disease, and immunological one, and these are the key players, all the important ones, the industrial one, Agilent technology, and then Illumina of course, and then Pfizer, Kaizen, all these industries they are putting a lot of money on this kind of things. So that's why the market is very rising up. You can see that in 2022, the 14.10 billions they have come up for they are predicted, and by region you can see that most of them they are using the US one, and apart from that, of course, other countries, other regions also developing the research. The next one. And you can see the annual growth rate of the using the technology. Here is the DNA sequencing is a lot, and following that is the microarray. And electrophoresis, as I said, still is a validation method for detecting the genetic variation. The PCR electrophoresis, the PCR RFID method. But nowadays you can see DNA sequencing. Right now, the technology wise they are using for validation and for finding the genetic variants. The huge rise for this one, 2022, they have predicted basically for the personalized medicine therapeutics, followed by medicine diagnostics, and also the medical care and personalized nutrition, what I was talking about, that microbiota. So these are the ones that are targeted, and definitely it is a huge chance for getting a lot of research grants for the institutes as well. The next one. And personalized medicine biomarkers, you can see that basically they are spending a lot of money for the treatment selection, and following that the early detection, because most of the patients they already get the disease and then only they are going to be spending a lot of money for the treatment selection, and following that some of them they want to know that whether I have the risk of developing any disease or not in future. So that's why they want to do the early detection using this kind of technology, and of course they want to diagnose the particular diseases and the monitor. So you can see that the more money has been utilized for the treatment selection. The next one. And mostly they have used the money for the oncology research, and following with that infectious disease, neurology, psychiatric, and the last one is the cardiovascular one. But these are the major one, but of course even in the other fields they are trying to use it, but mostly they are spending a lot of money on the oncology side. The next one. The region wise, as I said that the number one is of course the North America. They are spending a lot of money in the research then they are predicting the market will be very high in future, and following that the other parts, the Europe and Latin America, Middle East, Africa, and then Asian Pacific countries, all these things are following the similar one to identify the genetic profiling and also towards the personalized medicine. So you can see that what next one. You can see that what are the advantages for that. Of course, it can be reduce the chance of avoiding the side effects first, and you can reduce the cost of the healthcare.
RPE, because it's an epithelial cell, the more things that we want to see. Okay, you grow, they can see this dark color pigmentation. You can even do a bigger trial as well. Okay, and in my study itself, by focusing on SARS-CoV. Remember, just now I think they mentioned about in 2020, the most popular disease is SARS-CoV. And if let's say you still recall, the first is the ophthalmology. This happened. Why? Because they found out that patients have a red colored eyes. Right? So, in this particular disease, what I study is I take the SARS-CoV, I transfer it into my organoids. So I found out that because they have this receptor, we call it as a ACE2. If let's say you still remember back then, for you to get COVID, you need to have this receptor. We call it as a endogenous enzyme 2, ACE2. If let's say you have this receptor, you might be able to be transmitted with SARS-CoV. Okay, if let's say your organ without ACE2, you cannot get transmitted with SARS-CoV. That's why back then, one of the medications we're trying to improve is that we block the receptor of ACE into different types of molecules. This one I'm using PCR method because one ACE receptor with ACE2 and TMPRSS2 as well. Okay, so in my study,